All right, my name is Amanda Allen, and this is my head-to-toe assessment video. All right, I'm gonna go ahead and gather my supplies. I'm just gonna grab my stethoscope, my sphygmometer, my gloves, my tongue blade, my Q-tips, my pen light, my alcohol wipes, my KY gel lubricant, and my temperature reader. I'm gonna knock on the door. I'm gonna provide patient privacy and performing hygiene. My name is Amanda Allen. I'm here to do your head-to-toe assessment. I'm CDCC nursing student. Is that okay?
Yes.
Okay. And can you please verify your name and date of birth for me?
Amanda Williams, 4/13/98.
Okay. Do you have any allergies?
No.
Okay. Any pain?
No.
All right. And do you know where you are?
Yes, St. Francis.
Why are you here today?
Physical.
What's today's date?
11/16/2020.
Okay. And what is the present?
Mr. Trump.
All right. And my patient is oriented ×4 to person, place, time, and situation. Cognitive abilities are intact. Speech is intact. It is not slurred. My patient is dressed appropriately for the situation. Her demeanor is appropriate for the situation. She's sitting upright, legs are extended, and no signs of apparent illness, no signs of odor. Patient's face is symmetrical, skin matches ethnicity. All right, I'm gonna go ahead and do her vital signs. We just performed vital signs. Her blood pressure is 120/80. Her O2 sat is 97%. Her recitation rate is at 17. Beats per minute is at 77. And her temperature is at 97.5. All right, Miss Amanda, we're gonna go ahead and just look through this hair here. Hair color is brown. It's evenly distributed. No signs of infestation, alopecia. All right, do you feel my fingertips here?
Yes,
and
no pain.
tenderness. Okay. All right, and then I'm gonna go ahead and take this Q-tip, Miss Amanda. I want you to close your eyes. Tell me where you feel it.
Forehead, cheek, chin.
All right, cranial nerve 5 is intact. I'm gonna go ahead and feel for her temporal pulses. They're at 2+, normal rhythm. And then assessing for her skin, no signs of skin breakdown, warm to touch, no edema. All right, Miss Amanda, do you wear any sort of contacts?
No.
Okay. And her pupils are round and they are equal. I want you to just stare straight ahead at me as I bring my pen light. All right. Pupils are both reactive bilaterally to light, and I want you to focus on this pen light as I bring it towards you. All right. Eyes are able to accommodate bilaterally. I'm going to take a look at our sclera. It is white and glistening. Conjunctiva are pink and moist as well. No signs of crusting. All right, and I want you to focus on this pen light without moving your head, okay?
Okay.
Okay. Patient's cranial nerve 3, 4, and 6 are intact, but they will move through all 6 fields of gazes. Miss Amanda, I want you to come squint your eyes shut for me. Raise your eyebrows. Smile. Frown. Blow up air to cheeks. All right, blow up. Cranial nerve 7 is intact. All right, Miss Amanda, do you feel any sort of tenderness?
No.
Okay, nose is midline and nose is symmetrical. No sort of deviated septum. All right, Miss Amanda, we're gonna go ahead and check out that patency test. So please plug up one nostril and breathe out for me. Okay, other side, please. Okay, patient was able to breathe freely through both nares. All right, Miss Amanda, do you wear any hearing aids?
No.
Okay. Ears are both symmetrical, and I'm palpating down her auricle, her tragus, her lobules are masked for the process. Any sort of tenderness?
No.
All right. Ears are both symmetrical on both sides of her face, and no signs of skin breakdown. All right, Miss Amanda, we're going to perform a whisper test here. I want you to plug up one ear as I whisper to the opposite side, and repeat the word.
Soccer.
Other side, please.
Football.
All right. Hearing is intact bilaterally. And I'm going to go ahead and don on gloves, Miss Amanda. And we're going to go ahead and just go ahead and check out that mouth, okay?
Okay.
Just make sure that everything is proportioned. All right, gloves are on. Tongue blade in hand, and so it's pen light. All right. Patient's lips are already pink and moist, no signs of cracking. Please open for me, Miss Amanda. All right, tongue is pink and moist, no signs of thrush or nodules. Buccal mucosa on both sides is pink and moist, no signs of skin breakdown. Teeth are all intact and they're white, no signs of dental caries. Soft palate is pink and moist along with the hard palate. All right, and looking at those gums. Gums are pink and moist, no signs of skin lesions. And open up real wide, Miss Amanda. Stick your tongue all the way out for me. Tonsils are both intact, pink and moist. And all right, go ahead and press against that tongue blade. Say ah.
Ah.
All right. Uvula was able to go ahead and contract upright. Uvula is pink and moist in midline. All right. All right. So I just assessed for the gag reflex, and that is intact, along with cranial nerve 9 and 10. All right, and I'm going to go ahead and don off gloves, and I'm going to perform hand hygiene. Just perform hand hygiene. All right, Miss Amanda, we're going to go ahead and feel for that carotid pulse, okay?
Okay.
All right. Okay, 2 plus bilaterally, normal rhythm, and I want you to go and take your head, go up and down for me, side to side, and I want you to go and touch your ear on each side, please, of your shoulder. All right, force against my hand. All right, other side. Okay, and press up against my hands. Okay, cranial nerve 11 is intact, and we're gonna go ahead and assess for her throat here. All right, and we're also gonna go ahead and palpate for her lymph nodes. All right, I want you to tell me if there's any sort of tenderness,
No.
pre-auricle, post-auricle,
No.
occipital, cervical, submandibular, submental. Any sort of tenderness?
No.
Okay, lymph nodes were non-palpable, and we're also going to go ahead and assess for her trachea. Trachea is midline. Thyroid is smooth, firm, but is not enlarged, so no needed to go ahead and auscultate for bruits. And then I'm going to go ahead and assess for her upper extremities. And as I assess for upper extremities, I'm noting that her skin matches her ethnicity. Good skin turgor, no signs of edema. And I'm also going to go ahead and feel for her brachial pulse. Brachial pulse is 2 plus, normal rhythm. Radial pulse is also 2 plus, normal rhythm. Palpating palms of hands, color returns briskly. And then I'm also looking at capillary refills, and it fills in automatically under 3 seconds. And then for her skin, it is warm and dry. Okay, I want you to go ahead and pull down on my fingers, okay? Okay, and I want you to flex down, flex up. All right, have them out. Don't let me push them down. Don't let me push them up. Okay? Range of motion is intact, along with musculoskeletal system for strength. Okay, and then just go ahead and peer over here. We're gonna check that by Miss Amanda. Go ahead and lift up your breast for me. All right, upon inspection, it is not visible for the pulsing, but when I do go to palpate that apex, it is at a 2 plus normal rhythm. And I'm going to go ahead and palpate the breast as well. And it indicated that they're both symmetrical. Nipple is darker than the surrounding tissue. No signs of drainage. No signs of lumps, bumps, or any sort of masses or inflammation. When was your last menstrual cycle?
A week ago.
Okay. And do you not give a breast exam?
Yes.
Okay. So whenever you do that, you need to stand at the shower or at a mirror and start 12 o'clock. Move that eccentric circle. Pinch the nipple for drainage. If there's any drainage, please contact your doctor right away. This is always done 1 week after your menstrual cycle.
Got it.
Okay, and while I'm doing that, I'm gonna go ahead and palpate for her interior chest and work my way down. As I'm doing that, I'm watching for signs or any sort of tenderness from my patient. No signs of tenderness, skin matches, ethnicity, and I'm also gonna percuss. And that same exact order as well. And as I'm doing that, I'm also annotating that there's no edema, and she also has good skin turgor as well. And as I palpated, the second intercostal space of the left side resonated with the fourth intercostal space on to the right side. All right, Miss Amanda, just breathe every time you feel my stethoscope.
Okay.
All right, and I followed that same pattern all the way down the patient's chest, listening to her lung sounds, watching her rise and fall, and I'm noting that no accessory muscles were used as well. Okay, no adventitious sounds of any sort of crackles or wheezes, and we're gonna go ahead and listen to your heart sounds. So I'm gonna go into the second intercostal space for the aortic valve, and then moving over to the pulmonic valve in the second left intercostal space, moving down to Erb's point to the third intercostal space across near the sternal wall. And I need you to go ahead and lift up your breast for me. And then I'm going to go ahead and listen into that fourth intercostal space for the tricuspid valve. And then moving down to the mitral valve in the fifth intercostal space. And also listening for the apex for an additional 60 seconds. And I'll repeat this method with the bell of my stethoscope. And AP 1 and 2 were present. S3 and 4 were not there. No clicks or murmurs were indicated for the heart sounds. All right, Miss Amanda, we're going to go ahead and switch sides. Okay, I'm observing her scapula, and they're both symmetrical in midline. And then I'm also indicating for the patient's spine, no curvature is indicated and no signs of scoliosis. And then, oh my God. And then we're gonna go ahead and palpate all the way down, and I'm annotating for any signs of tenderness from my patient, no signs of tenderness. And patient skin turgor is good, along with temperature is warm, is dry, no signs of edema as well. And I'm percussing in that same pattern as well. All right, when I percuss, it resonated with T12. I'm gonna go ahead and auscultate in that same pattern. Please breathe when you feel my stethoscope. All right, all right. And you just follow in that same category. All right, and whenever I went to go ahead and listen for her lung sounds, no adventition sounds were noted. As far as wheezes and crackles, she was able to have her chest wall rise and fall without any sort of accessory muscles. All right, and I'm gonna ask her to turn around, and then she's gonna lay in supination, and I'm gonna ask her to turn her neck to the left side, and no for that jugular vein distension. No jugular vein distension is there. All right, and now I'm looking at the patient's abdominal region. When was your last bowel movement, Miss Williams?
Yesterday.
Okay, what's the color of that?
Brown.
Brown, okay. And what was the consistency?
Solid.
Solid, all right. And as far as were you trying to strain for it?
It was no strain.
No strain, okay. All right, and I just auscultated in all 4 quadrants, and bowel movements were present between 5 to 10 seconds. If they were not present, I would go ahead and listen an additional 5 minutes in each quadrant. And I just percuss in that same pattern of all quadrants. And Tiffany was intact, dullness resonated in all 4 quadrants. And I go ahead and palpate. No signs of tenderness from my patient is present. Skin was warm to touch. Skin matches ethnicity. No signs of skin breakdown or edema. I would go ahead and don on gloves, and I'll go ahead and inspect her vaginal region. Pubic hair, evenly distributed. No signs of masses, lesions. No signs of infestations or any sort of swellings. Labia minora and majora, they were pink, moist, symmetrical, and no signs of drainage or skin lesions there as well. I'll don off gloves, put on a new pair of gloves, and assess for the patient's rectum. She would turn onto her left-hand side, and I'll go ahead and assess her rectum. Rectum was darker, and then the surrounding tissue, no sort of swellings, masses, or lumps indicated, no signs of inflammation. Patient had good sphincter tone whenever I went to go ahead and insert my finger with the lubricant, and whenever I went to go ahead and pull out stool, it was normal color, consistency, and no signs of hemorrhoids as well. All right, I'll don gloves, perform hand hygiene, and then I'll go ahead and assess for her lower extremities. So good skin turgor, no signs of edema. Knees are midline and symmetrical along with her ankles, and her femoral pulse was at a 2+ normal rhythm. Her popliteal pulse is at a 2+ normal rhythm, along with her posterior tibulus is at a 2+ normal rhythm. And then for her dorsalis pedis is at a 2+ normal rhythm. I'll assess for a capillary refill for her toenails, and it is under 3 seconds. And then I'll go ahead and have her to go and push up her knees against my hands. All right, and then I would go ahead and ask her to extend her legs out, push against me. All right. Flex up, flex down. All right, wiggle your toes and rotate your ankles. All right, patient's range of motion is intact along with her resistance for musculoskeletal system for the lower extremities. I'd have my patient walk regularly towards me. All right. And now I'd have her do the tandem walk, heel to toe. Heel to toe. All right, patient's gait was equal bilaterally, no signs of sluggish movement. Balance was intact. I'll give her call light. I'll go and document my findings, perform hand hygiene, and I'll go ahead and exit.